Hi, welcome to this episode of Mary's Monday Musings. I am Dr. Mary Barson from Real Life Medicine, and today I am talking about holistic, integrated self-care and how holistic self-care is extremely important for cellular health and health in general. Dr. Lucy and I treat patients with obesity, chronic illness, mental health issues, all manner of conditions. We help people get well. We help people get their lives and their health back on track. It's what we like to do. And sometimes I have patients who have got their food, their nutrition, dialed in perfectly, absolutely perfectly. People who are eating whole food, low carb, who are cooking all their own meals, they've got their emotional eating under control, and they're doing intermittent fasting, and everything is absolutely perfect. And yet they're still not progressing. Perhaps they're not losing weight as much as they would want to, or the chronic pain isn't improving, or whatever it is, things aren't getting better despite really, really good nutrition. And as I explore that with these patients, the important point here is that food is extremely important for health and wellness. And yet, good health does not start and end with food. There are other really important factors to support the health of our cells, the health of our entire bodies. And they are pretty simple but profound things. Sleep, stress management, movement, social connectedness, time outdoors, time in nature. All of these things are extremely important for health. Some people like to describe these as the pillars of health, and I really like this model because it allows you to sort of really picture it. You could imagine that our health is, we want our health to be this nice sort of, safe and balanced structure up here, and it's supported by all these pillars. And these pillars that support our health are food. They are stress management, sleep, social connectedness, movement, time in nature. There's others you could include like toxin avoidance, don't smoke or drink to excess. But I'm going to focus on food, sleep, stress management, movement, time outside, time in nature, and social connectedness. So if you could imagine that pillar model, if you're sitting up here wanting to be well, but the only part of your lifestyle that you've really dialed in is food, well, then it's going to be pretty unstable. We also really need to work on all of those other factors as well. And it can sound really airy-fairy when a patient comes into me wanting to discuss weight loss and I start talking about their social connectedness, for example. Sometimes they look at me like I'm pretty weird. But it's scientifically validated. Indeed, what we do moment to moment really changes our genes. So the thoughts that we think, the food that we eat, the sleep that we get, the stress that we manage, the people we hang out with, the time that we spend outdoors, all of these things literally change our physical selves. Like they literally change the gene expression right down to the cellular level. And these choices that we make can either change our health in a good and healthful direction, or they can change our health in a bad and unhealthful direction. The choices that we make literally change our cells, literally change our brains, literally change our physical being. And so I would encourage all of you to take some time to reflect on your whole lifestyle and to take that really holistic view to your health. Food is important, but food isn't everything. Bye-bye.